One of the risks of being overweight, coupled with having poor lifestyle choices and consuming too much sugar over and over again, is the potential for developing type 2 diabetes. But if you're already diabetic, then you'll probably want to know how to exercise safely. So let's look at how. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I will give you some advice on how to exercise safely with diabetes, either type 1 or the more prevailing type 2. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. So there are two types of diabetes. Type 1 diabetes is normally a condition you're born with and is usually diagnosed when you're very young. This is where the pancreas in the body doesn't produce insulin, the hormone that picks up blood glucose from digestive food and transports it to the muscles and organs for energy. Therefore, the person has to inject insulin regularly every day to manage it, and only about 10% of people with diabetes have type 1. Type 2 diabetes is the more common condition that you can develop commonly in your 40s and 50s, but it's becoming more prevalent in younger people due to poor lifestyle choices, this being their diet and lack of exercise. This is where the body becomes more resistant to the insulin you actually produce, so the hormone is less effective in doing its job. In this client group, people will likely take medications such as metformin to help control their blood glucose levels, and their diet plays an important role in keeping their blood glucose levels balanced. With either type, exercise can play a key role in helping you manage your blood glucose levels. So let's identify the considerations you should take before embarking on your exercise journey. If you're diabetic, then being regularly active can greatly help improve insulin sensitivity. When undertaking physical activity and for several hours after, the muscle cells contract and remove glucose from the blood without the need for insulin, and this will help manage your blood glucose levels more effectively. For those with type 2 diabetes, exercise can help improve their HbA1c or average blood glucose levels, and I've had clients that have reduced their level below 48, therefore putting their type 2 diabetes into remission without the need for medication. Being diabetic is a risk factor for other health conditions such as heart disease, so exercise will help reduce this risk, preventing further complications by controlling your blood pressure, which should be below 140/80 at rest if you have diabetes, or below 130/80 if you have kidney or eye disease or any condition that affects blood vessels to the brain. In addition, exercise will also help improve your cholesterol. Then there are other associated benefits that come with being more active, such as increased energy levels, improved sleep, improved mobility and fitness. It reduces stress and improves mood, as well as giving you the boost to lose weight if you need to. Exercise is very safe if you're living with diabetes, providing you follow the appropriate advice given to you by the experts and the healthcare teams that you liaise with, and that you monitor yourself regularly to identify any changes to your condition. You may feel worried about passing out whilst exercising, and it's quite normal to feel anxious about starting if it's new to you. However, there are many elite athletes out there that compete at a very high level that suffer with diabetes. Five-time Olympic champion rower Sir Steve Redgrave is one such former athlete that proves that if diabetes is well controlled, there is no limit to what exercise you can do. As a matter of routine though, you should get into the habit of checking your blood glucose levels before you begin a form of exercise. Before you start, your blood sugar levels should be between 8 and 15 millimoles per litre. If it's lower, this is between 5 and 8 millimoles per litre, then you should take on 10 grams of carbohydrate first, then begin exercising. This can be in the form of food or drink. If your level is lower than 5, then you should eat or drink 10 to 20 grams of carbohydrate and wait for your levels to return above 5 before you start your activity. However, sometimes your blood glucose levels may be higher. This is greater than 15 millimoles per litre. If you get a reading this high, then you should check your blood ketone level. If ketones are present, you may have to take a correction insulin dose before starting. If you need more information on ketones, then pause this video so you can read through the graphic now on screen. Some medications, particularly insulin and sulfonylureas like gliclazide, although very unlikely, can cause hypoglycemia with exercise. So it's even more crucial to ensure that you have the balance right and be extra vigilant with your blood glucose checks. If you're on these medications and you think you might induce a drop in blood glucose, then make sure that you have a form of carbohydrate with you as an emergency backup. Jelly babies seem to work quite well. One important note is that you shouldn't exercise if you've had a severe hypo in the last 24 hours. The key is that everyone with diabetes has to manage this in their own way. So if you're new to exercising, just ensure you closely monitor your blood glucose levels, and this also includes after you've finished exercising for up to 24 hours. The best exercise for diabetes is the one that you will enjoy the most. There is no one size that fits all approach here because it's dependent on the individual. One person may have had diabetes for a long time, managing it really well and has no other complications, whereas another may have a multitude of other complex conditions, including hypertension, problems with their eyes, and peripheral neuropathy. Your best bet is to speak with your diabetes healthcare team to discuss what direction would be right for you. My advice is to find something that would motivate you to do it. Don't force yourself to go swimming if you feel embarrassed or self-conscious wearing a swimming costume in a public environment. It doesn't have to be structured exercise either, as it can be walking or cycling more for transport rather than taking the car, having frequent breaks from being seated so you stand up and move around, and even getting out in the garden. It's worth mentioning that you should take care in doing any exercise on your own and make someone else aware of where you are and what you're doing just in case. If you choose to go to the gym or take part in an exercise class, then be aware that steady state aerobic activity will cause the blood glucose level to drop, whereas high intensity or explosive activities are more likely to increase the blood glucose level, certainly in the first 30 minutes due to the stress hormones being released. This is also true for competitive sports. Firstly, if you're new to exercise, then sessions of 10 to 15 minutes will be a great starting point, and I've done a couple of 10-minute mini movers that you can follow along to at home to get you going. If you fancy trying out one of those, then click on the pop-up banner, or there'll be a link in the description below. If you're doing a longer routine, however, it's good practice to ensure that you warm up gradually for at least 5 minutes to allow the body to prepare for more intense exercises, including both cardiovascular and strength work. Make sure you stay hydrated, so if you're outside, ensure you take a drink with you. Make sure your feet are checked for sores and blisters, and subsequently your choice of footwear is appropriate for the exercise that you have chosen. Taking care of your feet is particularly important if you have diabetes, due to the increased risk of neuropathy, impairing proprioception, balance and motor control. For type 1 diabetes, you may have to check your blood glucose level before, during and after exercise to have an indication of the impact the exercise has, so that your insulin dosage can be adjusted accordingly until you then build up an identifiable pattern. I hope this video has helped you today. If so, please give it a like by clicking the thumbs up button below and share this video with friends to help this channel grow so more people can benefit from it. And remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.